Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll be presenting a very interesting remedy in relation to delusion. The remedy is DROSERA rotundifolia. Now everybody would be surprised that DROSERA, basically most of us have read about symptoms related to cough and a very interesting remedy for cough and cold. But do you know that DROSERA is a very interesting remedy for symptoms in relation to mind whenever there is delusion in relation to enemies? A DROSERA patient always feels, that he cannot rest. Everybody basically is trying to compete with him, trying to beat him, trying to go up with him. And there's always a delusion that enemies don't allow him to rest. Now, don't only think about enemies that they're enemies. In normal life also, I've seen a lot of patients, he says that I have to keep working hard because I feel that when I stop working, my competitors will come up. So that there is a feeling of enemies, that everybody is my enemy, so I have to keep working. If I don't, I'll be out of the race. I'll go down. I'll not succeed in life. And the same delusion I've seen in many of cases of DROSERA, where I have prescribed DROSERA with very good results. So remember, DROSERA is related a lot to enemies, that enemies don't allow him to rest, or it is also said that he is surrounded by enemies. A patient always feels that he is surrounded by enemies, and with this symptom, you could compare DROSERA with some remedies like Crotalus horridus or anacardium or mercury, but DROSERA is a very, very interesting remedy. Also, I have seen in cases where a DROSERA patient feels that he is pursued by enemies. कि मेरे पीछे लोग पड़े हुए, मेरे पीछे लोग पड़े हुए, मुझे काम नहीं करने दे रहे. That is he is pursued by enemies. The enemies angle is a very important mind symptom in DROSERA, and there are so many cases in my practice which I have seen and I have got good results with this symptom of delusion. Like for instance, pursued by enemies, कि मेरे पीछे लोग पड़े हुए. अब अगर उसको लगता है कि मेरे पीछे लोग पड़े हुए, he is thinking that they are enemies. He is thinking that they are competitors. He is thinking that he has to perform well. He is thinking that if he does not do well, he does not do right thing, the enemies will come and attack him. In the same symptom, also compare, like we have anacardium, we have Crotalus, we have Hyosamus, China, and Lachesis also have the same feeling that they are pursued by enemies. And what is the cause of this in DROSERA, which I have seen there is a delusion from, it is delusion, vexation and offense of vexations. So patient always feels that way. In the same way, it is related to anxiety also. उसको anxiety भी लगती है ना कि मेरे पीछे लोग पड़े तो नहीं है, मेरा क्या होगा. So anxiety also pursued as if, or anxiety as if pursued by enemies. सो पेशेंट को हमेशा फीलिंग रहती है कि मेरे पीछे कोई पड़ा तो नहीं है, मेरे को कोई तकलीफ तो नहीं देंगे, ये मेरे से बात कर रहा है, मेरा कोई गलत तो नहीं कर देंगे, वो मेरे बिजनेस में कॉम्पिटिटर है, वो मेरे प्रैक्टिस में कॉम्पिटिटर है, वो मेरे इसमें कॉम्पिटिटर है. ऑलवेज एक फीलिंग रहती है कि मैं कहीं फंस तो नहीं जाऊंगा, मेरे पीछे लोग पड़े, मेरे को कुछ कर तो नहीं देंगे लोग. दैट इज अ वेरी वेरी इंपॉर्टेंट फीलिंग ऑफ DROSERA. Sometimes he is able to cope up with the feelings, but sometimes if he is not able to cope up feeling, he feels that he is deceived. So delusion, deceived he is also a very, very important, a very, very interesting symptom of DROSERA. I had a very interesting case, he was a very big businessman and he used to always work day and night. And the feeling was that कि मैं अगर बिजनेस नहीं करूँगा, मैं एडवर्टाइजमेंट नहीं करूँगा, मैं मार्केटिंग नहीं करूँगा, मैं मेरे ऑफिस नहीं जाऊँगा, तो शायद हो सकता है मेरे वर्कर्स मुझे छोड़ दे, शायद वर्कर्स मेरे प्लान समझ के किसी और को बता देंगे, शायद मेरा बिजनेस ठप हो जाएगा, मैं शायद बिजनेस नहीं कर पाऊंगा. एंड दिस सेम फीलिंग ऑफ डिल्यूजन दैट एनिमी इज सराउंडेड बाय, परस्यूडेड बाय एवरीबडी, इज दैट ही कैन नॉट रेस्ट, इतना ज़्यादा था कि डेवलप्ड ब्लड प्रेशर, हाइपरटेंशन, हिज प्रेशर यूज्ड टू गो वेरी फास्ट. And in that case, I prescribed a single dose of DROSERA 200 and followed next month with the same dose, and the patient was cured with this complaint. So my dear friends, look beyond the remedies. Don't be looking at the specific part of remedies like DROSERA is only for cough. No doubt it is for cough, but the mind sim of DROSERA also important. And I hope you get good results by seeing this video and learning from your repeaters in Mater Medica. So my dear friends, if you like this video, do share and subscribe. Thank you.